All of the work I had planned for April and May and March as well is 100% cancelled. I have absolutely no employment now whatsoever.
No football means no income for sports cameramen. Last week, Johnny Lindsley was forced to apply for universal credit without success.
The phone either just automatically hangs up, or if you get through a couple of options on the menu, it eventually just rings out and hangs up.
Universal Credit is a new service.
Nearly 500,000 people have applied for universal credit since Monday of last week. The record demand is creating long delays for applicants. On social media, people have been sharing how long they've had to wait on the phone. For those who went online, it was no better. Alex found himself at position 103,000 in the queue. When we checked on his progress today, he said he'd finally got into the system at 3 a.m, but missed his slot as he was asleep.
We're currently experiencing high call volumes.
Jonathan Hume's contract as a research associate ended this month. He's called the Universal Credit Helpline between 80 and 100 times in the past few days.
Infuriating and stressful, because until this is sorted, I have no income. There'll be no communication from anyone. I think the system's just overwhelmed.
The unprecedented demand for benefits suggests a rapid, possibly record rise in unemployment, just as job centres have been shut. Closing job centres was inevitable in the current climate, but it will put more pressure on telephone support and online services. And that at a time when the system was struggling to cope anyway, with the many thousands of people forced to apply for benefits to make ends meet.
Can I bid you both a very warm welcome and thank you.
Appearing before MPs today, officials insisted claims were being processed, but they acknowledged the surge had created difficulties.
You've had capacity problems, absolutely, with the Verify system, working really closely with the Government Digital Service and their providers to build capacity in there. There are things that they're doing to build capacity to change the way that system works. Right. So I'm really hoping that that system will see some changes and improvements.
10,000 benefit officials will be moved to process the new claims. Lives suddenly interrupted, debts immediately soaring, the costs of a lifetime stacking up in days. Michael Buchanan, BBC News.
More than 500,000 people have signed up to the NHS Volunteers just 24 hours after an appeal was launched. The government's target was half that number, but they've been inundated with people wanting to help care for the most vulnerable, delivering food and medicines, driving patients to appointments and phoning people who may be isolated. The Prime Minister said they were essential in the fight against the virus. Our North of England correspondent Judith Moritz reports.
Hi, I'm Kirsty. I'm volunteering to do some driving for the NHS.
Hi, my name is Robert Howarth.
The NHS asked for help and thousands replied. An army of volunteers growing all the time who've signed up online to do their bit.
I've recently had pneumonia, so I couldn't put myself at physical risk, but this is a volunteer role that I can do from my home.
I'd like to offer some form of human connection and support to other people in my community.
I am volunteering so that there will still be an NHS around for my children when they're all grown up.
This feels very strange. I normally watch you on TV.
Pete Elwick is self-isolating but keen to help others and rushed to register last night.
We're very conscious of the help that we're getting from family, friends, and this just seemed the obvious thing as soon as I heard about it.
And tell me how exactly you are hoping to help through this app.
I suspect that some people will be just pleased to have a voice on the end of the phone, or even to have a phone call at all.
The NHS has advertised 4 separate volunteer roles through the app Good Sam.
From your sofa, like Pete, you can offer phone support to people who are feeling lonely. Or if you can get out and about, you can sign up to deliver supplies to people who are self-isolating, to transport patients who are fit for discharge, or to deliver equipment and medicines for NHS services like pharmacies.
This chemist has been inundated with orders, and its staff have given the news of volunteer help a cautious welcome.
I've got a really good delivery system in place. My drivers are checked and my drivers are trained with what to do. I'm very happy to use volunteers if they're at that standard. If they're not, though, we can still use them within the pharmacy to help us organise the workload for the delivery drivers and to support patient access elsewhere.
The volunteers are considered a vital part of the effort to cope in this crisis.
There's no health system in the world that would cope if coronavirus gets out of control. So yes, the NHS is stepping up. Our wonderful staff are doing all they can to ensure that we respond to this crisis. But we also need the public to step up as volunteers to help us.
The number of people signing up continues to rise. The NHS says it's possible to volunteer and stay safe through social distancing so that everyone can play a part during this emergency. Judith Moritz, BBC News.
And if you want a reminder of the new restrictions the government has introduced, you can find a full list of them on the BBC News website. Spain has now recorded more coronavirus deaths than China. 738 people with the virus died in the past day alone, taking the total over 3,000. Italy still has the highest death rate though. More than 7,500 people have died and over 75,000 have been infected. But the infection rate has slowed for a fourth successive day. In France, more than 1,300 people have died. Almost 3,000 people are in such a serious condition that they need life support, meaning more than 1/3 of France's ventilation beds are occupied. There's a similar situation in Spain, where more than 2,500 are in a serious or critical state. Almost 3,500 have died there. Our correspondent Damien Grammaticus joins us now from Madrid. Damien.
Sophie, yes, that bald fact here has been really shocking for many people, that Spain now, a country of 47 million people, has registered more deaths in this virus outbreak than China with its more than 1 billion people. Hospitals here are swamped. Every effort in Spain now is being mobilized to try to fight the virus. But what has really, I think, shaken people is that death toll. 738 in the past 24 hours, the highest of any country in the world today.
On a dark day for Spain, a sobering sight. Van after van carrying bodies of virus victims. This is Madrid's biggest ice rink. It's been requisitioned to hold the dead. They need it. There are so many now. Arriving at Spanish hospitals are more and more cases. Infections here leaping every day. And more than 5,000 medical staff have fallen sick too. So part of Spain's urgent efforts are these new rapid testing centres, specifically for those in the front line. Toñi Osuna, a nurse, fears she has the virus. A colleague has it. The swabs are invasive, unpleasant, handled with extreme care in case they've picked up the pathogen. Tony's worry she has a family she might have infected too.
I'm very worried, especially for my family and my patients. At home I stay in one room, isolated, treating myself for my symptoms alone.
So the whole of Spain has now mobilised to fight the virus. A tanker load of chemicals arrives at an army base on the edge of Madrid. Inside, they're now making hand sanitizer, gallons and gallons of it, to supply hospitals, so great is the demand.
What we are doing is very important. We do what we can to try to solve the crisis.
So in this battle, it's not bullets this military production line is making, but medicines to replenish stocks that are being used up fast.
And this is it, coming off the production line. Packs of paracetamol. Spain's military have put down their guns, and their weapon of choice in this fight now, packs of pills.
And across Spain, people everywhere are getting involved too. Designing and producing the goggles doctors are so short of. Those stuck at home sewing face masks for the elderly. Here, a nurse posts a thank you for the vital protective visor handmade by people living near to her hospital. And that thanks is returned. Every night in every city, town and village across Spain. Acknowledgement of the bravery and sacrifice the medics are making, the sound of a grateful nation. Damien Grammaticus, BBC News, Madrid.